Question: which of the following hormones is responsible for regulating calcium levels in the bloodstream? A. Insulin. B. Glucagon. C. Parathyroid hormone, PTH. D. Thyroxine, T4. Answer: C. Parathyroid hormone, PTH. Explanation: PTH is produced by the parathyroid glands and plays a crucial role in regulating calcium levels in the blood by promoting calcium release from bones and increasing calcium absorption in the intestines. Question: a patient presents with excessive thirst and urination, and laboratory tests reveal hyperglycemia and ketonuria. What is the most likely diagnosis? A. Hypothyroidism. B. Cushing's syndrome. C. Type 1 diabetes mellitus. D. Acromegaly. Answer: C. Type 1 diabetes mellitus. Explanation: the symptoms of excessive thirst, urination, hyperglycemia, and ketonuria are classic signs of type 1 diabetes mellitus, which is characterized by autoimmune destruction of insulin-producing beta cells in the pancreas. Question: which hormone is primarily responsible for regulating the body's metabolic rate? A. Insulin. B. Thyroid-stimulating hormone, TSH. C. Cortisol. D. Aldosterone. Answer: B. Thyroid-stimulating hormone, TSH. Explanation: TSH stimulates the thyroid gland to produce thyroid hormones, which play a key role in regulating the body's metabolic rate. 1. Question: which of the following hormones is responsible for stimulating the production of red blood cells? A. Insulin. B. Thyroxine, T4. C. Erythropoietin. D. Prolactin. Answer: C. Erythropoietin. Explanation: erythropoietin is produced by the kidneys in response to low oxygen levels and stimulates the production of red blood cells in the bone marrow. 1. Question: a patient presents with a palpable thyroid nodule and a fine needle aspiration biopsy reveals thyroid follicular cells with nuclear features suspicious of malignancy. 1. What is the most likely diagnosis? A. Thyroid adenoma. B. Papillary thyroid carcinoma. C. Hashimoto's thyroiditis. D. Multinodular goiter. Answer: B. Papillary thyroid carcinoma. Explanation: papillary thyroid carcinoma is the most common type of thyroid cancer and is characterized by distinct nuclear features seen in histology. 1. Question: in primary hyperaldosteronism, what is the most common cause of excessive aldosterone production? A. Adrenal adenoma. B. Pituitary adenoma. C. Thyroid carcinoma. D. Pancreatic tumor. Answer: A. Adrenal adenoma. Explanation: primary hyperaldosteronism is often caused by the presence of an adrenal adenoma, which leads to excessive aldosterone secretion. 1. Question: which hormone is responsible for promoting uterine contractions during labor and milk ejection during breastfeeding? A. Estrogen. B. Progesterone. C. Oxytocin. D. Follicle-stimulating hormone, FSH. Answer: C. Oxytocin. Explanation: oxytocin is produced by the hypothalamus and released by the posterior pituitary gland. It plays a key role in uterine contractions during labor and milk ejection during breastfeeding. 1. Question: which hormone is responsible for the regulation of blood calcium levels by stimulating calcium uptake in bone and inhibiting its release from the bone? A. Calcitonin. B. Parathyroid hormone, PTH. C. Thyroxine, T4. D. Insulin. Answer: A. Calcitonin. Explanation: calcitonin is produced by the thyroid gland and helps regulate blood calcium levels by promoting calcium uptake in bone and inhibiting its release. Scenario: a 25-year-old male with known hyperthyroidism due to Graves' disease presents with worsening symptoms, including palpitations and weight loss. What is the initial treatment of choice to control hyperthyroidism in this patient? A. Methimazole. B. Radioactive iodine therapy. C. Propranolol. D. Thyroidectomy. Answer: A. Methimazole. Explanation: methimazole is the first-line treatment for hyperthyroidism due to Graves' disease as it inhibits thyroid hormone production. Scenario: a 65-year-old female with a history of osteoporosis presents for a follow-up visit. She is currently on bisphosphonate therapy. What is the next step in her management? A. Continue bisphosphonate therapy. B. Switch to teriparatide. C. Initiate hormone replacement therapy, HRT. D. Discontinue all osteoporosis medications. Answer: A. Continue bisphosphonate therapy. Explanation: bisphosphonates are a first-line treatment for osteoporosis, and the patient should continue treatment, provided there are no contraindications or side effects.